introduce Dr. Ingrid Tyler, Cheryl Prescott, and Michelle Urbina. So Dr. Tyler is a medical health officer and the executive medical director for population and public health at the Fraser Health Authority. Cheryl is a senior member of the FH Population Health Group and has over 30 years of experience in working in the area of sexual health. Michelle is also a member of the Population and Public Health at Fraser Health and is a clinical nurse specialist for population and public health in the maternal and child health area for the Fraser Health Authority. And they will be speaking on Fraser Health Population Public Health Services for Women in Fraser Health and South Asian lens. Over to you.
Thank you very much. It's great to be here this morning and to see so many people online. I do see Cheryl and Michelle, and I just want to confirm who's driving the presentation.
That'll be me, Ingrid.
Okay.
Can everybody see the screen? It's Cheryl.
I don't see it yet.
Oh, okay.
I see you, not the presentation.
Okay, let me try. So I'm sharing my screen. And do you see it now? It's highlighted up on my screen. Does anyone see it?
No.
No.
Share.
No, can't see.
How about now?
Oh, now we see your folder file thing. There we go. Now we see the presentation.
Sorry about that, everyone.
Got it.
Just getting socialized to Zoom. We use Teams in Fraser Health, so my apologies.
No problem at all. I just wanted to make sure there's always a little tech time that needs to be built into these things to me for exactly this reason. So thank you very much for having us here today. We have a relatively short period of time to talk to you today about some of the services that we provide through the public health work as it relates to women's health. And so I just want to start by really appreciating Cheryl and Michelle for being here this morning and having put together this presentation and making themselves available to share their expertise with you. By the way of introduction to their presentation, I just want to say a few quick words about our South Asian Health Institute that lives within population and public health at Fraser, and basically aims to improve the health of our South Asian population through education, community outreach, and collaboration with Fraser Health programs and other partners. This will come as no surprise to most of those of you on the line, but around 75% of South Asians in British Columbia live within our Fraser Health region, where they make up about 15% of the population. So that means that about 1 in 8 Fraser Health residents identify as South Asians, and mainly seem to reside in Surrey, Abbotsford, and Delta. It was a number of years ago that Dr. Arun Garg, who I saw here a moment ago and we all know very well, who worked in Fraser Health, sort of conceived of the South Asian Health Institute and was very instrumental in making it happen. So we're all very grateful to him that we continue to have that service, which works to bring a South Asian lens to the healthcare services we provide. So and there he is in the picture with Victoria Lee, who was also founding of our South Asian Health Institute. So I do want to make ourselves available to all of you to ask questions about SAHI, either during this talk or to reach out to me directly. I'm relatively easy to find my email address, and to hopefully learn a lot about the maternal-child sexual health and women's health services that we provide through population and public health. And with that, I'm going to turn it over to Cheryl and Michelle.
Great.
Thank you, Ingrid.
So the maternal-child health program in Fraser Health is called the Best Beginnings program. It's a model to describe and the delivery of the standardized prenatal and postpartum newborn and family health services for pregnant women, new mothers, children to age 2 years of age, and their families. Our services provide a collaboration with clients in order to prevent, reduce the adverse perinatal and early childhood outcomes associated with psychosocial, environmental, and lifestyle risk factors. The Best Beginnings program is a mechanism to which Fraser Health implements the BC Ministry of Health Healthy Start initiative. The Best Beginning program includes both a universal and enhanced services. So in Fraser Health, we have what's called the Enhanced Family Visiting Program or the Nurse Family Partnership Program. Our programs focus on preventing adverse childhood experiences and builds on resilience of individuals and families. What our services include is a prenatal and postpartum population-based screening, such as tobacco use, substance misuse, depressive symptoms, and vulnerability screening. Our supports for healthy parenting and healthy child development, infant and child development screening, postpartum assessments at 24 to 48 hours post-discharge from hospital. We also include health promotion, education, so in person, on the telephone, virtually, and via our Best Beginnings websites and print materials. Our prenatal screening or our prenatal registration, which I will go through a little later, is how we would intake our clients into our program. Cheryl.
Thanks, Michelle. So I'm Cheryl. I'm the clinical nurse specialist for the regional sexual health and blood-borne infections program in Fraser Health. And really this program is regional, and we offer sexually transmitted infection and blood-borne infection prevention services, including follow-up on all of those reportable infections that public health would make extra efforts to follow up for folks who test positive or their partners, to ensure that we make sure we have good follow-up and prevent onward transmission. So the program that I work in has two arms. There's the sexually transmitted infection and HIV testing services that are available across the region, where really we are delivering sexual health prevention, treatment, testing. We're also following up on all of the newly folks who test positive for HIV. So we do that within our program, and we also support family doctors who may have clients and need some support around this new diagnosis. The other arm of our program, the focus is mainly on folks living with HIV in Fraser Health, and those that really do experience some challenges in accessing care, getting linked to someone who can oversee their care, and adherence to medication. So we have 5 different sort of sites across the region: Surrey, New West, Chilliwack, Abbotsford, Mission, where we would offer free STI testing and treatment. We have a mobile van, and we also now have an online testing, STI testing option in Maple Ridge called Get Checked Online. Go ahead, Michelle.
Thank you, Cheryl. So in Fraser, we have approximately 18,000 births. We have 17 health units across the region and 8 maternity hospitals. So how do you refer to us? So clients can complete the 5-minute survey online, and it can be found on the fraserhealth.ca/pregnancy website, or posters. We have the QR code, which will direct some patients into our website. If your patients would prefer a paper registration or some translated materials around the registration, our registration is translated in five different languages, including Punjabi. And so if the client prefers the copies of the paper registrations, they are able to fax it to the number that's provided in the back of the form. The registrations are automatically sent to the health units where the client resides, and then the prenatal registration is in the doorways to our Best Beginnings program services. And so based on the questions that are on the registration will determine the type of services we would offer our clients. Next slide. Here's an example of our landing page of our fraserhealth.ca/pregnancy websites. We know that many of our clients will want to kind of surf or look at Dr. Google for some information, but we were really trying to drive our clients to take a look at our evidence-informed information found on our site. What you can find on the site is our virtual maternity tours, which is translated in different languages for real time, anytime you can take a look at what the maternity hospitals will look like. Also, how to sign up for mobile text messaging. And so this text messaging system will provide some information according to the woman's gestation. And so 3 text messages will be going through to the client when they register, and they'll find some health promotion messages and some information that will go along with them as they move through their journey of pregnancy up until the child, or until one month postpartum. There's information on planning for pregnancy, pregnancy health information, the pregnancy journey, labor, birth, and early postpartum. We also have our new page of breast and chest feeding modules. So getting started and common challenges for breastfeeding. In addition, there's some life with your baby, 0 to 24 months. We also have the Edinburgh scale, depression and anxiety during and after pregnancy. And some of the materials are translated, and there are topics which include helpful, easy to understand videos. Next slide. Immunizations are an important part of public health, and due to our immunization program, diseases have significantly reduced or eradicated. Next slide. Vaccines that are part of the BC routine immunization schedule starts at 2 months and are free and can be provided by the family doctor, pharmacists for those 5 years and older, and our public health nurses. So in order to get immunizations, contact your doctor, pharmacist, or public health unit for an appointment. Vaccines that are not part of the BC routine immunization schedules are not free, and these vaccines can be provided at cost by your doctor, pharmacist, or the travel clinic. So again, on our Fraser Health website, there'll be information on how to contact us over the phone, and any of the community vaccine providers also are listed on our site. Next slide.
Great, thanks, Michelle. So that was awesome. I'll talk a little bit about sexually transmitted and blood-borne infections and women's health in Fraser Health. I think we could talk about this for quite an extended period of time, but I'm just going to pick 3 separate infections, look at the epidemiology in women, and then we'll talk a little bit about barriers and maybe why we see some of the numbers we see. So when you look on this screen in the top chart here, this is in reference to HIV infection and the number of people in Fraser Health who are living with HIV, both men and women. And this is up to the end of 2021. And so we call this a cascade of care. And this model is actually used in all of the regional health authorities, really to look at and evaluate how well are we linking folks with HIV to a care provider? How are they retained in that care? Do they stay on treatment? Are they adherent to their treatment? And do they eventually achieve viral suppression, which is our ultimate goal? When folks are living with HIV and they're on treatment and they achieve viral suppression, that means the virus is not at detectable levels enough to cause adverse health implications for themselves or to onward pass the virus on to someone else. So when we look at this cascade of care for men, we have about 1,827 men in Fraser Health living with HIV and around 575 women, so it would seem that there are less women, but where we get really interested is in these shaded areas that fall below the bar graph. And for women, as you can see at the stage where we would expect women along the cascade to achieve viral suppression, we have a substantive number falling out of care. So in comparison to men, women do fall out of care more often on the cascade. The graph at the bottom of the page, this is provincial level data, and this is actually the stark trend, upward trend of infectious syphilis in our province. So as you can see, in 2010, we have less than 400 cases of infectious syphilis for the year in BC, and up to 2021, we're surpassing 1,400 cases of infectious syphilis. And the orange part of the bar graph is reflective of women who have infectious syphilis in the province. And where we get concerned with that, we're concerned with all infectious syphilis, but for women of reproductive age, that actually increases the occurrence of babies born with infectious syphilis. And then lastly, I'll talk about chlamydia. Chlamydia is a very common sexually transmitted bacterial STI, and women are often overrepresented in the data for this. This again is provincial level data. And as we can see, the orange is women and represents women. And what we get concerned about with women is most often when women have chlamydia, they don't have symptoms that would alert them to take them to a clinician to get that checked out. We also find for all of these sexually transmitted infections is that often newcomers may come from countries where STI testing services or sexual health information is not available. So they may not even know that these services exist in the region. So now we're going to talk a little bit about the barriers. Michelle and I are going to tag team this a bit. We know in Fraser Health that the residents don't all have the same opportunities to be healthy. Social and economic circumstances cause large differences in health status, and we know that people's opportunity to stay healthy often depends on where they live, work, learn, and play.
And some important factors that affect women's health includes their housing, their neighborhoods, their jobs, their incomes, and their experiences of racism, sexism, and other kinds of discrimination. Language barriers also present a challenge and in themselves for women trying to access services that can be sensitive in nature and perhaps stigmatizing.
Yeah, so when you think about women trying to access these services that may be more sensitive in nature, like sexual health, if you layer on those further challenges, some of which Michelle mentioned, but we could go on to layer on domestic violence, poverty, trauma, these challenges can almost make it insurmountable for women to access services. So we really need to, as healthcare providers, take all of this into consideration when we're figuring out our programming and planning, and trying to achieve goals to provide accessible services that are ethical, that are competent, and that are safe for women to access.
And so for social and health inequities among newcomers populations were intensified during COVID-19. Sociodemographic data or sociodemographics are characteristics of the population. And so collecting this information, we can begin to understand the populations we serve. Through COVID-19, we've learned that access to language and interpretation services is a significant challenge that perpetuates health inequities. Fraser Health is committed to understanding the importance of collecting sociodemographic data and the desire to explore how to use the data to inform our programs to ensure equity, diversity, and inclusive initiatives that are within the development and implementation of the programs. Also, the cross-sectoral collaboration between Fraser Health and organizations such as the Canadian India Network Society, South Asian Institute, the Sikh Gurdwaras, to name a few, are included in the conversation to ensure that we have culturally safe, effective, equitable, diverse, and inclusive informed policies and public health practice.
Yeah, so really, when we're addressing barriers, one of the most important things we need to do is understand the populations that are most affected, which is work that's happening now in terms of data collection for specific ethnicities and race, and then also including those affected populations in your program planning and how services can align with their identified needs. So in our sexual health program, we do rely heavily on contracted community partners, such as agencies like Sarah for Women. We also work really closely with FRAFCA, which is the Fraser Regional Aboriginal Friendship Centers. And we also have an interdisciplinary team that includes social work and outreach work. We really do need to further expand outreach into community, and that is part of our 2022-2027 strategy moving forward for our program. So that kind of concludes our portion of the presentation. So we're happy to take questions.
Thank you all very much. That's awesome. And as a long time past employee of Fraser Health, I just love getting the updates, and having been one of the authors on the business case for SAHI, it always excites me to hear about the great work that's happening with the South Asian Health Institute. As Dr. Garg and Dr. Lee will attest to, when we were bringing that to Ministry of Health and to other bodies for its approval, it was quite a process. So happy to see that work continuing. We have a question, and you kind of addressed it a little bit right there in the end about the outreach to the community, some of the work that you're doing and your focus for the year ahead. Are any of these services fee for service for the patients or the individuals, or are all of these services covered by our universal healthcare? And how does that play out with potentially immigrants that may not necessarily be current residents of Canada?
I mean, I'm happy to speak for the sexual health side of things. We do have free testing for sexually transmitted and blood-borne infection, and that's available across the province through the provincial lab, and free treatment, which is a provincial drug treatment program that's available in all regional health authorities for sexually transmitted infection. The HIV side of things is a little bit different, because that is a fee-for-service program. So it's not universally, if you don't have healthcare, there has to be an alternate pathway to be linked into service and provided treatment for that.
And for the maternal-child program, it is a voluntary program. It is free to our residents, and those who are new to our country. It is also a program that is free for service and is part of our funding, our Ministry of Health funding.
Thank you. And we have another question. Are these services updated to include the new healthcare hubs? I believe they're primary care centers. Maybe that's what they're called. I'm not sure. Healthcare hubs being created in BC. So how are you guys potentially linking into some of these provincial changes?
Ingrid, did you want, I can talk about SHIBI. Did you want to talk about PPH in general?
Yeah, I have a bit of an answer for this one, but I just want to confirm if I'm not familiar with the language healthcare hubs. Can I assume that we're talking about PCNs?
That's what I assumed, Ingrid, okay, by the question, but it's one of our generic Jesse Downies who asked the question. So let's go with that assumption. Yes, I think it's PCNs. Yes.
Yeah. There's actually, I think there's quite a bit of opportunity for public health in general around the PCN initiative. We are working closely with our division partners across the region to try and see how we can, how we can better work together, because that's a big part of the intention of the PCNs, and make services more accessible. It's obviously a significant change initiative, so though systems change takes time. So I can imagine it will be some years before you will see things on the ground seem materially different than they are now. But the conversations around how to partner around immunization, how to get prenatal registration rates up, how to be more effective in sharing information around STI, for example, through the new PCN structure, that those are happening in many different forums.
Perfect, thank you. Also, Dr. Ingrid, you so warmly put the offer out there. If people wanted to contact you, they could find your email address. So we took the liberty to post your email address, and you mentioned that earlier. So if anybody is interested in reaching out to Ingrid, then her email address is posted in the chat box. Also, there was a question about, do you have any advertising material, like a pamphlet or something like that, that you use for your programs? And if you do, if you want to share that with us, we can share it with the attendees of this meeting as well. So that was a question that somebody had asked. I don't know, like a pamphlet or something like that. The person.
Yeah, we do, and happy to forward that on. I think it's available through the print shop as well in Fraser Health, but we have client directed brochures, and then brochures also for healthcare providers if they need support with new HIV diagnoses, with follow-up for STI. Mm-hmm.
Okay, so if you want to share that with us,
Sure.
we can distribute that to people. So thank you guys very much. That was awesome. We do have to move on to our next speaker. So I will hand it back to Nita. Thank you very much.
So before I move on, I'd like to congratulate the 3 speakers for the great coordination. They handled it very well.